Do I need oxygen? Of course, fucking everybody needs oxygen, but I have to tip it. Since we've established that I'm carrying a huge amount of fat, I raised the weight from 20 kilos to 25, I think. Continue my day just chilling. Okay guys, so there's this bag on my bed and I'm like, what is it doing here? I need to move it. Pacey in it. She's been there for a long time. She's literally clinging this bag, you guys. She's proper chilling there. Look at her feet, all stretched. It's her new hideout spot. And my sandwich bag is here. Okay, I'm gonna take it out. Lynette, you love this bag, don't you? I have to give it her now. I literally have no choice. It's the morning of Tuesday, the 28th of September, and I just got an email to fill out the questionnaire from that portal that they invited me to. And on there it still says that my surgery is going ahead on the 30th, and you know, I'm sure it's a mistake. Regardless of that, I really want to fill out that questionnaire to just see what kind of questions they have, and maybe if I fill it out now I'll be able to use it for when my surgery does happen. I don't know. I don't think it will do me any harm if I do fill it out now, so I'm gonna do it now. Okay, so let's do this. There's 7 pages. You need to fill out your personal details, your name, your date of birth, insurance company, about me, stuff like, do you wear contact lenses or do you have any body piercings, your weight, oh very sensitive subject, your height. Okay, I'm just gonna fill this out and then I'll continue filming. Okay, so I filled that all out. Now they're asking me my surgical history. Respiratory questions are, have you ever been to the hospital before? Have you ever had an operation before? Sedation, local anesthetic, blah blah blah. Have you ever suffered from asthma? Do you smoke? Are you an ex-smoker? Yeah. And it says, do you suffer from obstructive sleep apnea? I don't think I am. I think I would know if I do. So yeah, that's page 2 out of 7. Okay, I'm so confused right now. So it says, please tick that apply. And they have the selection of answers that I may tick. So check this out. I produce sputum every winter. I know what that is, so I probably don't produce this stuff. I've been diagnosed with bronchitis or this. Okay, I haven't. I have lung cancer. No. I had an operation box. No. I get short breaths on moderate exercise. Maybe not. And then this one. I need oxygen. Like, do I need oxygen? Like, of course everybody needs oxygen, but do I have to tick it? Does it refer to like an extra oxygen supply of some sort? I don't understand this. I'm just not gonna tick it, you know. I don't think it will cause any problems, but if they do ask me, are you sure you don't need oxygen? I'll be like, I do, but do I have to? You know what I mean? So I'm not gonna tick it. Okay, so then we have page 3, cardiovascular. I have had some cardiovascular problems, I believe, when I was very little, but not anymore. So it says high blood pressure. Nope. Suffer from hypertension. Okay, so it basically asks all the questions related to cardiovascular system. So now we have page number 4. Here they ask stuff about gastrointestinal, diabetes, hepatic, renal, neck problems, all of that stuff, which I don't have, thankfully. It says, do you drink alcohol? So little, you guys, like virtually none. Have you ever had pancreatic stomach problem? I did have a stomach problem when I was little, but it's just like no. Diabetes. Do you have any neck problems? Page number 5, they ask about clotting. Have you ever had bleeding problems or clots? Do you have any condition problems with easy bleeding and bruising? Hematology, anemia stuff, leukemia, neurology. Have you ever had a stroke, epilepsy, mental health and memory loss? Kind of questions here. Page number 6, they ask me about thyroid. I have no idea what it is. I need to Google that. And then they ask about my medication and drugs. What type of medication, how many do you take, allergies and infections, mobility, needle phobia. I clicked on something and it basically went all the way to the start of the questionnaire. I didn't save any of the answers, so I have to redo everything now. Luckily, I just have to say no to everything, so it's not a big deal. But just the fact that I have to do it all over again, like why is it not saving? So I get to this question, they ask me, this is a mobility section. So they ask me, have you had falls? My first reaction is, what? Like falls? As in, is it like some kind of, I don't know, disease or something? Like, have you had pox or something? Have you had whatever? The way it's phrased, it may imply that it's a name of some disease. And I'm like trying to Google it, and it just seems like it literally refers to you falling somewhere. And like, dude, have you met anyone in your life who haven't fallen, just in general, who haven't fallen? Like, just this, like, so here's Jack is 30 years old and he's never ever fallen in his life on the floor. He hasn't bumped into anything. When he was a kid, when he was like 5 years old, he was running around in the neighborhood and he just never falls. Like this guy, you know, like those Russian dolls that never fall. What kind of question is that? Obviously everyone's fallen before. The thing is, I understand if like the follow-up question would be, do you bruise easily or something, you know, like related to that. But the next question after that is, do you have mobility problems or need mobility aid? And that's it. So this combination of questions, it just doesn't fucking make any sense. So mobility, have you had falls? Yes. And then, do you have mobility problems? And that's it. And then there's a needle phobia. Am I missing the point here or what? Anyway, so I don't have a needle phobia. You can fucking needle the fuck out of me. So with that, we are approaching the last section, page 7. And page number 7 is for any additional details. If there's anything that wasn't covered, the questions above which you feel we should know, please give further details. Maybe I should talk about the falls and how I bruised like a normal human being or something. Maybe that's what they want from me. And then there's COVID details and statement. Are you a healthcare worker? Have you had a hospital admission within the last 4 weeks? All that shit. So that's the questionnaire, you guys. I'm gonna submit it, and please don't tell me that I have to submit it all over again like next time, but I'll probably have to, you know, with details like COVID related questions. Of course I'd have to, but I just wanted to see what it is, what it contains, and I was just curious, so I'm filling it out now. Now that I've filled out the questionnaire for the surgery that is not happening in 2 days, we can come back to the conversation about the fact that I'm fat. So, since we've established that I'm carrying a huge amount of fat on me, I looked up exercises that I can do to reduce the level of subcutaneous or some shit. Fat that is just, you know, fat that you get on your belly, on your legs, and all that shit that causes you to look bigger than what you should look. Anyway, it basically said that cardio is the best bet, or heat exercises, or, you know, just running would be the best option for me, the option that I'm okay with. So I'll probably have to go running daily, and I just have to, I mean, I don't have a problem with that, it's fine. I'll just go run on the treadmill or something. And I'm gonna do it now, though it hasn't been 48 hours since the laser thing. I think it's fine, it's been like a day, it's fine. I'm trying to the fact that you guys know it. So I'm gonna go to the gym in a minute, but I'm gonna have breakfast first. Other than that, it's my second day of holiday. I'm enjoying it very much. I've been watching vloggers, I've been reading a book, and sleeping a bit longer. I've been chilling with the cats. It's been really enjoyable so far. No news on the surgery front whatsoever. I mean, I was telling somebody at first I was fine with the surgery being delayed because I think I was under the impression that it would just be moved by a week or two, but she never actually said that, so it might be moved to next month, it might be moved to fucking next year. Okay, not next year, but you know what I mean. The more I think about it, the more mad I become, and I'm like, dude, why am I mad? It's happening, you know. It's a bit annoying, it's a bit uncomfortable because I'd have to move my holidays around. I'd have to, you know, come in and out of my holidays to work and not work, but it is what it is. It's not the end of the world, it's happening, so I shouldn't be mad, but I am. a little bit. Sometimes I'm more mad than the other, but it comes and goes, you guys. It comes and goes. So I'm just rolling with it for now. See that? I was supposed to infuse my water with some kind of fruit. I usually use lemon, blueberry. However, I ran out of everything. So what I did instead, I put some squash, and it looks like I'm having some weird mix. It doesn't even look like oranges, it looks very toxic. It's just squash, tropical squash with water. And as you can see, I'm all ready to go to the gym. I'm all ready to lose my fat. I don't know how long it will take. I feel it's really weird that I've been going to the gym for a month and I don't even know if anything changed. It's crazy to me. It's absolutely fucking insane, but I'm still determined to do a good job, so I'm gonna try and run for 40 minutes today. What I can do, potentially, I can run for 30 minutes, take a break, do some strength workout or something, and then go back on the treadmill again, you know? What I usually do, I've noticed, is that I'm trying to get out of there as fast as possible. So I go there, do my workout, take any breaks, and get out. But no one's rushing me. I can be there all day. I'm not going to be there all day. All I'm saying is I can take my time and I can go and do certain exercises over and over again with a little bit of a break in between. So basically, I really pushed myself in a fucking gym today. I ran for 30 minutes and then I went on workout machines and I pushed myself real hard there. I raised the weight from 20 kilos to 25, I think. I raised the amount of reps per machine type. Then I did an ab workout, not the clothing, somebody else, and I enjoyed it way more, you guys. It was like non-stop, non-break workout. After that, I ran for 20 extra minutes, so I spent like an hour and a half or maybe even 2 hours in gym there, like crazy. I really fancy a watermelon slash feta salad. I remember having it this one time and I just remember it being so amazing, and I really fancy it now, so I'm gonna go to the shop and go. Thinking recently that I've changed my mind, you know, when I told them that it's okay that my orthodontist sees me instead of the surgeon on day 7 and day 14. This is because my orthodontist has zero experience of dealing with surgical cases, so I'm not sure if I said it. Maybe I've said it already. Because she has no experience of doing that, I would be more confident and more calm and more with it if I see a surgeon, at least on day 7, and then on day 21. So I'll try to bring that up with them, and I hope it won't be an issue. Even seeing a surgeon for like 5-10 minutes would be enough for me. I also find it very weird and very disorganized, you guys, the fact that they never mentioned that my orthodontist would need to be present during the surgical planning, so she doesn't know about it, and I didn't know about it until they called me to delay the surgery. So they told me that she'll need to be present during the surgical planning Zoom call with the states. She'll need to agree on the surgical movements proposed by everybody, and then so she will need to make time for that, and she will need to be, I don't know, educated enough on the subject. And you know, there's this whole thing, the sheer fact that she would need to be present during this appointment and them not ever mentioning it. I feel embarrassed to email my orthodontist office. I just feel embarrassed. I'm going to let them deal with it and organize everything, you know? Like, how difficult is it to literally tell me the whole thing? It would take you 5 minutes, less than 5 minutes, to literally tell me the whole plan of action, you know, and what would be required from who and when. I also wanted to say that I kind of had a feeling that my surgery would be delayed when we had that last joint clinic appointment with me, my orthodontist, and the surgeon, he said, okay, so your teeth need to just not move at all from now on. I mean, from whenever. And it worked out perfectly, because we said that, look, my next appointment is going to be on August 9th. And he was like, okay, perfect, because he said, if that's the case, we can schedule the surgery for the 30th of September, because it takes roughly on and off 2 weeks for the surgical planning to happen. And I was thinking to myself, yeah, it's possible if everything is done perfectly, you know, all the scans are sent out on time, and you know, everything is done. It would be a tight squeeze, but it would be possible. But honestly, even thinking at the time that there may be an issue with how tight the deadlines are for them to organize and sort everything out, to be honest with you guys, I did have a feeling that they would just not manage, and they didn't. It's purely based on the fact that there's so many parties involved and everything needs to be organized, and though they did their best to chase each other, and you know, it just didn't happen, and it's okay. I was just saying that, yeah, I had a feeling that it wouldn't, and now I have a feeling that my surgery would happen in November, not October. So I need to reframe my brain and start thinking about coming back to work. And Lyra got a liking to chilling in the litter box. I don't understand why he finds it attractive, but he does it. They don't use this litter box to poop, so they only pee there. So yeah, he just does it randomly with this litter box alone. All of that stuff is my boyfriend not doing the cleaning properly, so no judgment there. Okay, I'm just gonna leave him there to chill.